Hello everyone. So we will continue our series that is must know one-liners for Neetpg. Today we will cover 50 one-liners of forensic medicine in less than 10 minutes. So I will be reading the question and their answer only. So we will cover our 50 question in 10 minutes. First question is child delivered after death of biological father is called as posthumous child. Second, sexual gratification by rubbing the private parts of the another person is called voyeurism. Third, in which type of hanging does the weight of head act as constriction force? It is partial hanging. Then fourth question, sexual gratification by taking obscenity and sharing obscene picture is called as scatologia. Scatologia is new term. You have to remember this. Then to perform MTP for mentally challenged female, legal consent is obtained from the legal guardian for MTP of mentally challenged female. So here they have not mentioned the age but they mention mentally challenged female. So if mentally challenged female is there, we have to take the legal consent of guardian. Tachycardia and visual hallucination of red colored halo are seen with which one? LSD. So poison is important in FMT. So tachycardia and visual hallucinations of red colored halo are seen with visual hallucinations. Remember this with LSD. Then most common organ injured in seatbelt injury, it is mesentery more than hollow viscous. If both options are there, mesentery and hollow viscous, go with mesentery. Then test for semen detection with yellow needle crystals. Yellow needle crystals. It is Barberio test. Yellow needle crystals. Okay. Then caliber of rifle barrel weapon depends on rifle barrel weapon. Caliber depends on distance between two opposite lands. Distance between two opposite lands depends on. Okay. Then preservative used for blood in autopsy, it is potassium oxalate. Then moving forward, range of gunshot shows stellate shape. Stellate shape shown in contact shot. Stellate shown in contact shot. Then first post-mortem change occur in dead body. Greenish discoloration of right iliac fossa. Greenish discoloration of right iliac fossa. The first post-mortem change occurs in dead body. Then single best bone for sex identification, it is pelvic bone or pelvis. Then method of autopsy carried out en masse to remove organ from tongue to prostate. En masse removal of organ from tongue to prostate is Letiol technique. Remember the technique of autopsy. It is very important. First en masse remove of organ from tongue to prostate. Letiole. Term for comprehensive examination of death in all its aspects is called as thanatology. Then next, cherry red post-mortem staining is associated with poisoning of carbon monoxide. Easy question but important. Cherry red carbon monoxide. Which inquest typically conduct in dowry death? Dowry death, judicial magistrate inquest. Dowry death, judicial magistrate inquest. Then term for doctor receive payment in exchange of referring a patient is dichotomy. Dichotomy, referring a patient, doctor receives payment. Poison which can be found in skeletonized remain is arsenic. Skeletonized remain, the poison which identifies arsenic. In which type of wound hair bulbs are noted to be crushed? That is laceration. Hair bulb noted to be crushed in laceration. Then burning, blackening, tattooing around the wound seen in close shot entry wound. Entry wound close shot. Burning, tattooing, blackening. Then identical twins doesn't have similarities in fingerprint pattern. In fingerprint pattern, identical twins doesn't have similarities. Then rigor mortis first occur in very important question, that is myocardium. First occurs in myocardium. Then luminescent stool are associated with poison of phosphorus. Luminescent stools. Phosphorus is luminescent. Then Edmond Locard is most famous for theory of exchange. Locard gives the theory of exchange. Then measline associated with or and poisoning mimics cholera is arsenic. Arsenic measlines and the poisoning which resembles cholera is arsenic poisoning. Then next, leading questions are not prohibited in cross examination. In which technique of autopsy organ are removed by one, that is Virchow's, one by one Virchow. And we have seen which one, Litiol technique, remove of organ from tongue to prostate. Second one Virchow, one by one, remember. Then Hodge tragedy is associated with poison of methanol, methanol poisoning, Hodge tragedy. Then hyperkalemia, paresthesia root most toxic, that is aconite poisoning. Mancode paresthesia hyperkalemia, it is aconite poisoning. Same menstrual cycle, two was fertilized by two different sperms, that is superfecundation. Superfecundation, two different coitus. Okay, two ova fertilized, same menstrual cycle. Superfetation is two different menstrual cycle. Okay, then mummification is a odorless process. Question. Then most common organ damage during blunt trauma is spleen. So in seatbelt mesentery, in blunt trauma most organ is spleen. Heavy object, clean cut edges, crush tissue is example of chop wound. In chop wound, there is heavy object, clean cut and crushed tissues in chop wound. Then the role of doctor in dying declaration is known as compos mentis. That is, compos mentis is a role of doctor in dying declaration. Then confirmatory test to establish the presence of blood stain at a crime scene is spectroscopic test. At crime scene, establish the presence of blood stain is spectroscopic test. Then poison which cause red velvety discoloration of stomach. Here important, that is stomach mucosa is arsenic. Red velvety discoloration of stomach mucosa is arsenic. Then postmortem change is called as taphonomy. Taphonomy is postmortem changes. Then physiological antidote for scorpion venom is prazosin. Prazosin. Physiological antidote. Then most reliable criteria, Gustafson's criteria for age estimation is translucency of root. Gustafson's criteria for age estimation, translucency of root. Then gutter fracture of skull bone is associated impact due to bullet gutter fracture. Sorry. Most common organ injury in air blast shock wave is tympanic membrane more than lungs. So 3 most common damage during burn trauma is spleen, in seat belt mesentery, and here tympanic membrane in shock waves. Then homicidal method, traumatic asphyxia, that is barking and smothering. Homicidal method, traumatic asphyxia, barking is more than smothering. Brick red postmortem staining seen in cyanide poisoning. Brick red postmortem staining. Postmortem, it is important. Then most common Cause of death in judicial hanging, cervical was fracture or dislocation in judicial hanging. Then drug that commonly leads to physical dependency, heroin. Heroin gives physical dependency, most commonly leads to. Which poison caused by bullet retained inside body? That is lead. Poisoning caused by bullet retained inside body, that is lead poisoning. Acute liver failure is a chief complaint of which of the following? Amantophiloids. Then bitter almond. Smell seen in which poisoning? That is cyanide. Bitter almond smell seen in cyanide. Then butterfly bruise seen in battered baby syndrome. Butterfly bruise. Bitter almond in cyanide. Acute liver failure. Amantophiloids. Which poisoning cause bullet retained inside? That is lead poisoning. Drug that commonly leads to physical dependency, heroin. Okay, so we have covered 50 MCQs in less than 10 to 20